81. Which of the following is the most common presenting symptom of lung cancer? A. Hemoptysis. B. Chest pain. C. Weight loss. D. Cough. Answer: D. Cough. Rationale: cough is the most common symptom of lung cancer, often occurring early. Hemoptysis, chest pain, and weight loss are also common, but less frequent at the time of diagnosis. 82. Which of the following is the most common cause of cancer-related pain? A. Nerve compression. B. Tumor infiltration. C. Surgery. D. Chemotherapy. Answer: B. Tumor infiltration. Rationale: tumor infiltration, where the cancer spreads to surrounding tissues and structures, is the most common cause of cancer-related pain. Nerve compression, surgery, and chemotherapy can also cause pain, but are less common. 83. Which of the following cancers is most likely to cause ascites? A. Colon cancer. B. Ovarian cancer. C. Pancreatic cancer. D. Lung cancer. Answer: B. Ovarian cancer. Rationale: ovarian cancer frequently causes ascites due to the accumulation of fluid in the abdomen as a result of tumor spread. Colon, pancreatic, and lung cancers may also cause ascites, but are less common. 84. Which of the following is a risk factor for developing endometrial cancer? A. Early menopause. B. High estrogen levels. C. Low body weight. D. Prolonged breastfeeding. Answer: B. High estrogen levels. Rationale: high estrogen levels increase the risk of developing endometrial cancer, particularly in the absence of progesterone. Early menopause, low body weight, and prolonged breastfeeding are not considered strong risk factors. 85. Which of the following is a common sign of anemia in cancer patients? A. Jaundice. B. Fatigue. C. Fever. D. Night sweats. Answer: B. Fatigue. Rationale: fatigue is the most common sign of anemia in cancer patients due to reduced oxygen delivery to tissues. Jaundice, fever, and night sweats may be associated with other conditions, but are not primary signs of anemia. 86. Which of the following is the most common site of metastasis for colon cancer? A. Liver. B. Brain. C. Bone. D. Lungs. Answer: A. Liver. Rationale: the liver is the most common site for colon cancer metastasis, followed by the lungs. The brain and bones are less commonly affected. 87. Which of the following is a potential complication of chemotherapy? A. Osteoporosis. B. Anemia. C. Hypercalcemia. D. Hyperglycemia. Answer: B. Anemia. Rationale: anemia is a common complication of chemotherapy due to its effect on bone marrow and red blood cell production. Osteoporosis, hypercalcemia, and hyperglycemia are less common chemotherapy-related complications. 88. Which of the following cancers is most likely to cause hyperkalemia? A. Renal cell carcinoma. B. Lung cancer. C. Leukemia. D. Pancreatic cancer. Answer: C. Leukemia. Rationale: leukemia can cause hyperkalemia due to rapid cell turnover and release of potassium. Renal cell carcinoma, lung cancer, and pancreatic cancer can lead to other electrolyte imbalances, but are less commonly associated with hyperkalemia. 89. Which of the following is the most common type of brain tumor in adults? A. Meningioma. B. Glioblastoma multiforme. C. Pituitary adenoma. D. Astrocytoma. Answer: B. Glioblastoma multiforme. Rationale: glioblastoma multiforme is the most common and aggressive type of primary brain tumor in adults. Meningiomas, pituitary adenomas, and astrocytomas are less common but also significant. 90. Which of the following factors is most likely to influence a patient's prognosis in breast cancer? A. Tumor size. B. Family history. C. Patient age. D. Smoking status. Answer: A. Tumor size. Rationale: tumor size is a critical factor in determining prognosis in breast cancer. Larger tumors typically correlate with a worse prognosis. Family history, age, and smoking status are important but less predictive of prognosis than tumor size. 91. Which of the following is the most common site for metastasis of prostate cancer? A. Liver. B. Lungs. C. Bones.
D. Brain.
Answer: C's bones. Rationale: prostate cancer most commonly metastasizes to the bones, particularly the spine, hips, and pelvis. The liver, lungs, and brain are less common sites of metastasis. Answer: C's bones. Rationale: prostate cancer most commonly metastasizes to the bones, particularly the spine, hips, and pelvis. The liver, lungs, and brain are less common sites of metastasis. 92. Which of the following is a key characteristic of a malignant tumor? A. Well-defined borders. B. Slow growth rate. C. Ability to metastasize. D. Non-invasive nature. Answer: C. Ability to metastasize. Rationale: malignant tumors are characterized by their ability to invade surrounding tissues and spread, metastasize, to other parts of the body. Well-defined borders, slow growth, and non-invasive nature are more characteristic of benign tumors. 93. Which of the following cancer treatments involves the use of drugs to stop cancer cell growth? A. Surgery. B. Chemotherapy. C. Radiation therapy. D. Hormone therapy. Answer: B. Chemotherapy. Rationale: chemotherapy uses drugs to stop or slow the growth of cancer cells. Surgery removes tumors. Radiation targets cancer cells with high-energy rays, and hormone therapy blocks or alters hormones to slow cancer growth. 94. Which of the following cancers is associated with the human papillomavirus, HPV? A. Ovarian cancer. B. Cervical cancer. C. Pancreatic cancer. D. Colorectal cancer. Answer: B. Cervical cancer. Rationale: cervical cancer is strongly associated with HPV infection, especially type 16 and 18. Ovarian, pancreatic, and colorectal cancers are not typically linked to HPV. 95. Which of the following is the most effective screening method for breast cancer? A. Mammogram. B. Ultrasound. C. MRI. D. Biopsy. Answer: A. Mammogram. Rationale: mammograms are the most effective and widely used screening method for breast cancer. Ultrasound and MRI are used in specific situations, while biopsy is a diagnostic tool rather than a screening method. 96. Which of the following is a side effect of radiation therapy? A. Hair loss. B. Hypotension. C. Insomnia. D. Weight gain. Answer: A. Hair loss. Rationale: hair loss is a common side effect of radiation therapy, particularly when treatment involves the head or neck. Hypotension, insomnia, and weight gain are less common effects of radiation therapy. 97. Which of the following cancer treatments targets specific cancer cells based on their genetic makeup? A. Chemotherapy. B. Immunotherapy. C. Targeted therapy. D. Hormone therapy. Answer: C. Targeted therapy. Rationale: targeted therapy involves drugs that specifically target and inhibit cancer cells based on their genetic characteristics. Chemotherapy, immunotherapy, and hormone therapy are also treatments but work through different mechanisms. 98. Which of the following is the most common type of leukemia in adults? A. Acute myeloid leukemia, AML. B. Chronic lymphocytic leukemia, CLL. C. Acute lymphocytic leukemia, ALL. D. Chronic myeloid leukemia, CML. Answer: A. Acute myeloid leukemia, AML. Rationale: AML is the most common type of leukemia in adults, whereas ALL, CLL, and CML are more common in children or older adults in the case of CLL. 99. Which of the following signs indicates the progression of prostate cancer? A. Urinary retention. B. Hematuria. C. Erectile dysfunction. D. Weight loss. Answer: A. Urinary retention. Rationale: urinary retention can be a sign of prostate cancer progression due to the tumor obstructing the urethra. Hematuria, erectile dysfunction, and weight loss may occur but are not as directly indicative of progression. 100. Which of the following is the hallmark feature of pancreatic cancer? A. Jaundice. B. Abdominal pain. C. Weight loss. D. Bursitis. Answer: A. Jaundice. Rationale: jaundice is often the hallmark feature of pancreatic cancer due to obstruction of the bile duct. Abdominal pain, weight loss, and ascites are also symptoms, but are less characteristic. 101. Which of the following is the primary treatment for non-small cell lung cancer, NSCLC? A. Chemotherapy. B. Radiation therapy. C. Surgery. D. Immunotherapy. Answer: C. Surgery. Rationale: surgery is the primary treatment for early-stage non-small cell lung cancer, NSCLC. Chemotherapy and radiation may be used in advanced stages or after surgery, while immunotherapy is an emerging treatment option. 102. Which of the following is a common side effect of chemotherapy in cancer patients? A. Increased appetite. B. Hair loss. C. Weight gain. D. Muscle hypertrophy. Answer: B. Hair loss. Rationale: hair loss is a well-known and common side effect of chemotherapy due to its effect on rapidly dividing cells, including hair follicles. Increased appetite, weight gain, and muscle hypertrophy are not typical side effects of chemotherapy. 103. Which of the following is a characteristic feature of metastatic cancer? A. Confined to one area. B. Ability to spread to other parts of the body. C. High rate of spontaneous remission. D. Lack of symptoms. Answer: B. Ability to spread to other parts of the body. Rationale: metastatic cancer is defined by its ability to spread beyond its original site to other parts of the body. It is not confined to one area, does not have a high rate of remission, and typically presents with symptoms. 104. Which of the following is a common diagnostic test used to detect breast cancer? A. Colonoscopy. B. Mammogram. C. Biopsy. D. MRI. Answer: B. Mammogram. Rationale: mammograms are the most common screening test used to detect breast cancer. Colonoscopy is used for colorectal cancer, while biopsy and MRI are used for diagnosis and staging. 105. Which of the following cancers is most associated with smoking? A. Ovarian cancer. B. Lung cancer. C. Skin cancer. D. Pancreatic cancer. Answer: B. Lung cancer. Rationale: smoking is the leading risk factor for lung cancer. Ovarian, skin, and pancreatic cancers are associated with other risk factors, but smoking is most strongly linked to lung cancer. 106. Which of the following is the most common cancer in women worldwide? A. Ovarian cancer. B. Cervical cancer. C. Breast cancer. D. Uterine cancer. Answer: C. Breast cancer. Rationale: breast cancer is the most common cancer in women globally. Ovarian, cervical, and uterine cancers are less common. 107. Which of the following cancers is most often diagnosed through a Pap smear? A. Endometrial cancer. B. Ovarian cancer. C. Cervical cancer. D. Uterine cancer. Answer: C. Cervical cancer. Rationale: a Pap smear is the primary screening test for cervical cancer, which helps detect abnormal cell changes before cancer develops. It is not used for endometrial, ovarian, or uterine cancers. 108. Which of the following is a common sign of colorectal cancer? A. Unexplained weight loss. B. Abdominal pain. C. Blood in the stool. D. All of the above. Answer: D. All of the above. Rationale: unexplained weight loss, abdominal pain, and blood in the stool are all common signs of colorectal cancer. These symptoms warrant further evaluation for the disease. 109. Which of the following cancers is most likely to cause a decrease in calcium levels? A. Lung cancer. B. Prostate cancer. C. Breast cancer. D. Multiple myeloma. Answer: D. Multiple myeloma. Rationale: multiple myeloma is associated with hypercalcemia, a condition in which calcium levels in the blood are abnormally high. Other cancers like lung, prostate, and breast cancer can also affect calcium levels, but they're less frequently associated with this condition. 110. Which of the following factors increases the risk for developing liver cancer? A. Hepatitis C infection. B. Diabetes mellitus. C. Obesity. D. All of the above. Answer: D. All of the above. Rationale: hepatitis C infection, diabetes mellitus, and obesity are all known risk factors for developing liver cancer. Chronic liver disease, including cirrhosis from hepatitis C, plays a significant role in liver cancer risk. 111. Which of the following is the most common type of skin cancer? A. Melanoma. B. Squamous cell carcinoma. C. Basal cell carcinoma. D. Merkel cell carcinoma. Answer: C. Basal cell carcinoma. Rationale: basal cell carcinoma is the most common type of skin cancer, typically appearing as a shiny, pulley bump. Squamous cell carcinoma and melanoma are less common, and Merkel cell carcinoma is rare. 112. Which of the following cancers is most likely to cause fatigue in the early stages? A. Prostate cancer. B. Lung cancer. C. Leukemia. D. Breast cancer. Answer: C. Leukemia. Rationale: leukemia often causes fatigue early in the disease due to the impact on blood cell production. Fatigue can occur in other cancers, but is more commonly reported early in leukemia. 113. Which of the following cancers is most often treated with hormone therapy? A. Breast cancer. B. Lung cancer. C. Pancreatic cancer. D. Colon cancer. Answer: A. Breast cancer. Rationale: hormone therapy is commonly used to treat hormone receptor-positive breast cancer by blocking the body's hormones or lowering their levels. It is not typically used in lung, pancreatic, or colon cancers. 114. Which of the following is a common complication of advanced cancer? A. Hyperthyroidism. B. Hypokalemia. C. Sepsis. D. Hypercalcemia. Answer: D. Hypercalcemia. Rationale: hypercalcemia is a common complication of advanced cancer, particularly in cases of bone metastasis. It occurs due to the release of calcium from bones and affects many cancer types. 115. Which of the following is a significant risk factor for ovarian cancer? A. Early menopause. B. Oral contraceptive use. C. Family history of breast cancer. D. Low-fat diet. Answer: C. Family history of breast cancer. Rationale: a family history of breast cancer, especially with BRCA mutations, increases the risk for ovarian cancer. Early menopause and oral contraceptive use have a protective effect, and a low-fat diet is not a significant risk factor. 116. Which of the following cancers is most strongly linked to a family history of a disease? A. Pancreatic cancer. B. Breast cancer. C. Liver cancer. D. Kidney cancer. Answer: B. Breast cancer. Rationale: a family history of breast cancer, particularly with genetic mutations like BRCA1 and BRCA2, significantly increases the risk of developing breast cancer. Pancreatic, liver, and kidney cancers have weaker familial links. 117. Which of the following treatments is commonly used for brain cancer? A. Chemotherapy. B. Radiation therapy. C. Surgery. D. All of the above. Answer: D. All of the above. Rationale: treatment for brain cancer typically involves a combination of surgery, chemotherapy, and radiation therapy, depending on the tumor's location and type. 118. Which of the following is a common sign of cervical cancer? A. Abnormal vaginal bleeding. B. Pelvic pain. C. Pain during intercourse. D. All of the above. Answer: D. All of the above. Rationale: abnormal vaginal bleeding, pelvic pain, and pain during intercourse are all common signs of cervical cancer, often seen in the later stages. 119. Which of the following cancers is most associated with a high-fat diet? A. Colon cancer. B. Lung cancer. C. Pancreatic cancer. D. Ovarian cancer. Answer: A. Colon cancer. Rationale: a high-fat diet has been associated with an increased risk of colon cancer, especially with diets high in red and processed meats. Other cancers may be influenced by diet, but not as strongly as colon cancer. 120. Which of the following cancers can be detected using a colonoscopy? A. Colorectal cancer. B. Stomach cancer. C. Liver cancer. D. Kidney cancer. Answer: A. Colorectal cancer. Rationale: colonoscopy is the gold standard for screening and detecting colorectal cancer. It is not used to detect stomach, liver, or kidney cancers. 121. Which of the following is a potential complication of cancer treatment? A. Anemia. B. Liver failure. C. Kidney stones. D. Insomnia. Answer: A. Anemia. Rationale: anemia is a common complication of cancer treatment, especially chemotherapy, due to its impact on red blood cell production. Liver failure, kidney stones, and insomnia are less commonly associated with cancer treatment. 122. Which of the following is a characteristic of melanoma? A. It is always benign. B. It has irregular borders. C. It does not spread to other parts of the body. D. It typically has a smooth surface. Answer: B. It has irregular borders. Rationale: melanoma is characterized by its irregular borders, asymmetry, and often changes in color. It can spread to other parts of the body, unlike benign lesions. 123. Which of the following is a risk factor for prostate cancer? A. High levels of estrogen. B. Family history of prostate cancer. C. Low calcium intake. D. Low-fat diet. Answer: B. Family history of prostate cancer. Rationale: a family history of prostate cancer is a major risk factor for developing the disease. Estrogen levels, calcium intake, and fat consumption are not strongly linked to prostate cancer. 124. Which of the following cancers is most likely to cause symptoms of jaundice, yellowing of the skin and eyes? A. Pancreatic cancer. B. Colorectal cancer. C. Lung cancer. D. Bladder cancer. Answer: A. Pancreatic cancer. Rationale: pancreatic cancer often causes jaundice due to its proximity to the bile ducts. Colorectal, lung, and bladder cancers may cause other symptoms, but typically do not lead to jaundice. 125. Which of the following cancer treatments can cause bone marrow suppression? A. Radiation therapy. B. Chemotherapy. C. Surgery. D. Immunotherapy. Answer: B. Chemotherapy. Rationale: chemotherapy often causes bone marrow suppression, leading to a reduced ability to produce blood cells, including red blood cells, white blood cells, and platelets. Radiation therapy and surgery are less likely to have this effect. 126. Which of the following is a known risk factor for bladder cancer? A. Exposure to radon. B. Smoking. C. Obesity. D. Low fiber intake. Answer: B. Smoking. Rationale: smoking is the leading risk factor for bladder cancer. Exposure to radon, obesity, and low fiber intake are not strongly linked to bladder cancer. 127. Which of the following is a common side effect of radiation therapy? A. Weight gain. B. Nausea and vomiting. C. Hair loss. D. Increased appetite. Answer: C. Hair loss. Rationale: hair loss is a common side effect of radiation therapy, particularly when the head or neck is treated. Nausea, vomiting, and weight gain are possible but less common. 128. Which of the following cancers is most often diagnosed in people over the age of 50? A. Childhood leukemia. B. Colorectal cancer. C. Lung cancer. D. Liver cancer. Answer: B. Colorectal cancer. Rationale: colorectal cancer is most often diagnosed in people over the age of 50, though it can occur in younger individuals. Leukemia, lung, and liver cancers may also affect older adults, but are not as common in this age group. 129. Which of the following cancers is associated with human papillomavirus, HPV? A. Oral cancer. B. Bladder cancer. C. Prostate cancer. D. Kidney cancer. Answer: A. Oral cancer. Rationale: human papillomavirus, HPV, is a known risk factor for oral cancers, particularly oropharyngeal cancer. It is not strongly linked to bladder, prostate, or kidney cancers. 130. Which of the following is the most common treatment for early-stage non-small cell lung cancer, NSCLC? A. Surgery. B. Chemotherapy. C. Radiation therapy. D. Immunotherapy. Answer: A. Surgery. Rationale: surgery is the most common treatment for early-stage NSCLC to remove the tumor. Chemotherapy, radiation, and immunotherapy may be used in advanced stages or after surgery. 131. Which of the following is a common symptom of leukemia? A. Abnormal bleeding or bruising. B. Persistent cough. C. Chest pain. D. Blood in the stool. Answer: A. Abnormal bleeding or bruising. Rationale: Leukemia often causes abnormal bleeding or bruising due to a reduction in platelet production. Other symptoms such as persistent cough, chest pain, or blood in the stool are not as common in leukemia. 132. Which of the following is a common sign of pancreatic cancer? A. Jaundice. B. Painful urination. C. Bloody stool. D. Persistent cough. Answer: A. Jaundice. Rationale: jaundice is a common sign of pancreatic cancer due to bile duct obstruction. Painful urination, bloody stool, and persistent cough are not typical signs of pancreatic cancer. 133. Which of the following is a common risk factor for colorectal cancer? A. Low fiber diet. B. High calcium intake. C. High consumption of fruits and vegetables. D. Regular exercise. Answer: A. Low fiber diet. Rationale: a low fiber diet, along with high consumption of red and processed meats, is a major risk factor for colorectal cancer. High calcium intake, a healthy diet, and regular exercise can reduce the risk. 134. Which of the following is the most common symptom of kidney cancer? A. Blood in the urine. B. Weight gain. C. Chest pain. D. Nausea. Answer: A. Blood in the urine. Rationale: blood in the urine, hematuria, is the most common symptom of kidney cancer. Other symptoms may include pain, weight loss, or nausea, but blood in the urine is more indicative of kidney cancer. 135. Which of the following is a major risk factor for cervical cancer? A. Exposure to asbestos. B. HPV infection. C. High-fat diet. D. Radiation therapy. Answer: B. HPV infection. Rationale: human papillomavirus, HPV, infection is the leading cause of cervical cancer. Asbestos exposure, high-fat diet, and radiation therapy are not major risk factors for cervical cancer. 136. Which of the following is a common treatment for melanoma? A. Chemotherapy. B. Immunotherapy. C. Surgery. D. Radiation therapy. Answer: C. Surgery. Rationale: surgery is the most common treatment for melanoma, especially in the early stages. Chemotherapy and radiation therapy may be used in advanced stages, while immunotherapy is becoming more common for treatment. 137. Which of the following is associated with a higher risk of developing liver cancer? A. Hepatitis B infection. B. Frequent alcohol consumption. C. Both A and B. D. None of the above. Answer: C. Both A and B. Rationale: both chronic hepatitis B infection and heavy alcohol consumption increase the risk of liver cancer. Other factors like obesity and non-alcoholic fatty liver disease also contribute. 138. Which of the following cancers is commonly treated with stem cell transplantation? A. Prostate cancer. B. Leukemia. C. Skin cancer. D. Ovarian cancer. Answer: B. Leukemia. Rationale: stem cell transplantation is commonly used to treat leukemia, particularly in cases of relapse or high-risk leukemia. It is not typically used for prostate, skin, or ovarian cancers. 139. Which of the following is a major risk factor for esophageal cancer? A. Smoking. B. High fruit consumption. C. Excessive alcohol use. D. All of the above. Answer: D. All of the above. Rationale: smoking, excessive alcohol use, and a diet low in fruits and vegetables all increase the risk of esophageal cancer. Other factors, such as obesity and acid reflux, also contribute to the risk. 140. Which of the following is a common symptom of ovarian cancer? A. Abdominal bloating. B. Night sweats. C. Bloody stool. D. Chest pain. Answer: A. Abdominal bloating. Rationale: abdominal bloating is a common symptom of ovarian cancer, often accompanied by pelvic pain and changes in appetite. Other symptoms like night sweats and chest pain are not typically associated with ovarian cancer. 141. Which of the following is a common risk factor for developing colorectal cancer? A. High-fat diet. B. Low fiber intake. C. Smoking. D. All of the above. Answer: D. All of the above. Rationale: all listed factors are well-established risk factors for colorectal cancer. A high-fat diet, low fiber intake, and smoking increase the risk of developing the disease. 142. What is the most common treatment for non-small cell lung cancer, NSCLC? A. Surgery. B. Chemotherapy. C. Radiation therapy. D. Targeted therapy. Answer: A. Surgery. Rationale: surgery is often the first-line treatment for non-small cell lung cancer when the cancer is localized. Chemotherapy, radiation, and targeted therapy may be used as adjuncts depending on the stage and type of cancer. 143. Which type of cancer is the most common in women? A. Ovarian cancer. B. Endometrial cancer. C. Cervical cancer. D. Breast cancer. Answer: D. Breast cancer. Rationale: breast cancer is the most common cancer in women, surpassing ovarian, endometrial, and cervical cancers. 144. What is the purpose of adjuvant chemotherapy? A. To cure the cancer. B. To shrink the tumor before surgery. C. To prevent cancer recurrence. D. To manage pain associated with cancer. Answer: C. To prevent cancer recurrence. Rationale: adjuvant chemotherapy is given after surgery to eliminate remaining cancer cells and reduce the risk of recurrence. It is not intended to cure the cancer on its own or manage pain. 145. Which of the following cancers is most commonly associated with human papillomavirus, HPV, infection? A. Lung cancer. B. Skin cancer. C. Cervical cancer. D. Stomach cancer. Answer: C. Cervical cancer. Rationale: HPV infection, particularly types 16 and 18, is strongly linked to the development of cervical cancer. It is not a common cause of lung, skin, or stomach cancer. 146. Which of the following is a common complication of prostate cancer treatment? A. Erectile dysfunction. B. Hair loss. C. Nausea and vomiting. D. Weight gain. Answer: A. Erectile dysfunction. Rationale: erectile dysfunction is a common complication of prostate cancer treatment, particularly after surgery or radiation therapy. Hair loss, nausea, vomiting, and weight gain are more common with other treatments like chemotherapy. 147. Which of the following cancers is associated with the highest mortality rate in men? A. Lung cancer. B. Prostate cancer. C. Testicular cancer. D. Colorectal cancer. Answer: A. Lung cancer. Rationale: lung cancer has the highest mortality rate in men due to its aggressive nature and late-stage diagnosis. Prostate cancer has a higher survival rate, while testicular and colorectal cancers generally have better outcomes. 148. Which of the following is the most common form of skin cancer? A. Squamous cell carcinoma. B. Melanoma. C. Basal cell carcinoma. D. Merkel cell carcinoma. Answer: C. Basal cell carcinoma. Rationale: basal cell carcinoma is the most common type of skin cancer, accounting for the majority of cases. Squamous cell carcinoma and melanoma are less common, and Merkel cell carcinoma is rare. 149. Which of the following is a typical early symptom of ovarian cancer? A. Abdominal bloating. B. Skin rash. C. Headache. D. Chest pain. Answer: A. Abdominal bloating. Rationale: early symptoms of ovarian cancer often include abdominal bloating, pelvic discomfort, and changes in urinary habits. Skin rash, headache, and chest pain are not typical early symptoms. 150. What is the primary treatment for acute myeloid leukemia, AML? A. Stem cell transplant. B. Chemotherapy. C. Radiation therapy. D. Hormonal therapy. Answer: B. Chemotherapy. Rationale: chemotherapy is the primary treatment for acute myeloid leukemia, AML, often followed by stem cell transplant in some cases. Radiation therapy and hormonal therapy are not standard treatments for AML. 151. Which of the following is a primary risk factor for developing melanoma? A. Dark skin. B. High altitude. C. Excessive sun exposure. D. Family history of breast cancer. Answer: C. Excessive sun exposure. Rationale: excessive sun exposure, particularly sunburns, is a significant risk factor for melanoma. Dark skin is protective against melanoma, and family history of breast cancer is not a known risk factor for melanoma. 152. Which of the following cancer types is most closely associated with chronic hepatitis B infection? A. Liver cancer. B. Colon cancer. C. Bladder cancer. D. Stomach cancer. Answer: A. Liver cancer. Rationale: chronic hepatitis B infection is a major risk factor for liver cancer, hepatocellular carcinoma. It is not strongly linked to colon, bladder, or stomach cancer. 153. Which diagnostic test is commonly used to screen for colorectal cancer in asymptomatic adults over 50? A. Colonoscopy. B. Mammography. C. MRI scan. D. Chest X-ray. Answer: A. Colonoscopy. Rationale: colonoscopy is the gold standard for colorectal cancer screening, recommended for adults over 50. Mammography is used for breast cancer screening, and MRI and chest X-rays are not typically used for colorectal cancer. 154. Which of the following is a common side effect of radiation therapy? A. Fatigue. B. Increased appetite. C. Insomnia. D. Seizures. Answer: A. Fatigue. Rationale: fatigue is a common side effect of radiation therapy, often due to the body's energy consumption while healing. Increased appetite, insomnia, and seizures are not typical side effects of radiation. 155. Which of the following is the best way to prevent lung cancer? A. Avoiding sun exposure. B. Regular exercise. C. Quitting smoking. D. Using sunscreen. Answer: C. Quitting smoking. Rationale: quitting smoking is the most effective way to prevent lung cancer, as smoking is the leading cause of this cancer. Sun exposure and sunscreen are more relevant to skin cancer, and exercise is beneficial, but not directly related to lung cancer prevention. 156. Which of the following is a common sign of advanced pancreatic cancer? A. Weight loss. B. Swelling of the legs. C. Severe headaches. D. Chest pain. Answer: A. Weight loss. Rationale: unexplained weight loss is a common sign of advanced pancreatic cancer, along with abdominal pain and jaundice. Swelling of the legs, headaches, and chest pain are not characteristic of advanced pancreatic cancer.